Psychoneurology, we're fascinated with the understanding of how the unconscious works and how we can add those new learnings. Some of the things I'll share now, we would use more for our particular work for the university or for providing an introduction. So I'm going to talk a little bit more for a moment right now about that. So here we go. So one of the fundamental distinctions we have in the field of psychoneurology from traditional psychiatry or even psychology is that the old model of the two-step model of diagnosis and treatment is a place where it puts our focus on the specific problem, the specific issue to be addressed, and negated. And that works very well in the medical field, which is, by the way, where it was copied from, was from the medical doctors. If you had a cut, I could negate that particular wound. In psychoneurology, we realize the mind doesn't work the same way. The mind has to be told specifically what to do. If I tell you don't think of a white horse, it's pretty much the same as saying think of a white horse. The unconscious doesn't process negation. Ayn Rand, the genius who wrote The Fountainhead and Atlas Shrugged, said it best. She said, when I was a little girl, the clock struck and the refrigerator broke, and I learned that clocks break refrigerators. It's a very, very apt expression of how the unconscious actually works. If someone is very, very frightened, and let's say there's a dog there barking at them, that fear and the dog can be linked up, and a phobia is an example of a one-trial learning. In other words, that individual has a single event, but it's intense enough, and it creates a new association. And that's the way the unconscious works. This also can occur for things we're labeling as ADD, PTSD, or any of these other expressions of just the unconscious doing its particular function. The answer to this is very simple. It will never be to get rid of that association. The answer has to be to add a new neural pathway, a new learning. And when we do that, we give that individual entirely new choices. And we have a very, very effective, new, expanded addition of that particular context. So for example, if I was frightened of dogs, dogs mean fear, if I can add new neuroassociations where dogs can mean something else, luckily the unconscious always moves towards pleasure and moves away from pain. I will choose those more resourceful neural pathways every single time. So that's something that we can keep in mind in psychoneurology. Our job is to add resources to you. If someone comes to us and we don't add new learnings to you, we don't feel we've done our work. So as opposed to psychotherapy, which tends to be more processing oriented and the idea of working out things and kind of getting things from your unconscious to your conscious mind and somehow that they'll change from that, is very different from our perspective. We're highly active as opposed to passive. We're highly directive in terms of creating new learnings. And those of us I've worked with many individuals, over a dozen individuals who had situations of abuse, and they were abusers, and they knew everything about why they were abusers, but it didn't stop them from being abusive. And I've worked with individuals time and time again who knew what they were doing, but couldn't stop it. Psychoneurology, we're fascinated with the understanding of how the unconscious works and how we can add those new learnings. And we find what we call the calibration strategy, where that person is, and we identify the resource that will create that new result for them, and then we help them integrate that resource. That's our three-step model. Instead of diagnosis and treatment, ours is basically putting our mind where we want it to go. So we start with calibration. Where are they? We identify the resource that will help them get there or create the change they want. And then we help them integrate that resource. That's our three-step model. And that's how you can see psychoneurology, the new psychology of thriving, is very directive and very focused.